Hi, I'm Virginia from Write Clinic, and this is the Medical Writing Uncut podcast. Here with me today is Nikita. Thank you so much for being here.
Thank you so much for having me.
Awesome. So Nikita has a really interesting story, and so I'll let her introduce herself.
Well, hi everyone. My name is Nikita. I'm a pharmacist by training, and I also have a PhD in biomedical engineering. Plot twist. So yeah, absolutely. Just a quick introduction about myself. I've worked both in the UK as a clinical pharmacist, and I've worked in the US for the last 13 years as an engineer, a scientist, and a developer, and a medical writer as well.
Brilliant. I love that you have such a broad career and you've touched on lots of different aspects of science there. And so do you want to maybe go into why you moved to the US and you left your kind of clinical pharmacist role in the UK?
Yeah, so absolutely. I started out as a clinical pharmacist in the UK working at Boots. Shout out to Boots. It was a very enjoyable experience. But I felt there was more that I could offer with the degree and the knowledge that I had being a pharmacist. And this led to a pivot of me deciding to do a PhD in the US in biomedical engineering. Might be hard to tether the two together in terms of skill sets because they sound very different. But I specialized in tissue engineering, which really pulled a lot of my pharmacy knowledge in physiology and systems into the engineering aspect. And it was just a really nice way of repackaging pharmacy knowledge into different applications.
Awesome. And so you also mentioned in a previous conversation that you were involved in AI development, which I think is really interesting because it, has recently taken off and there are lots of kind of applications of AI. So do you want to talk about your kind of experience in the development and maybe whatever you're able to share?
Absolutely. So my path has been very much being flung into AI. It wasn't a career decision. It was something that evolved over time with different roles. And I've worked across things like computer vision with AI all the way through to medical content and clinical evidence pipelines. For me, AI is very much emerging in the healthcare space in multiple regions. It's going to impact clinical writing and the way we use information. It's going to impact clinical decision-making as well, enabling doctors and clinicians to, make decisions with more information, with more streamlining, with more support as well. And I think in drug discovery as well, it's a huge space right now is how can we leverage these massive sources of data with AI? It's a really exciting time, but I think there's also responsibility and ethics in clinical writing and how we use AI within all of these facets that's going to be very interesting and very important to address early on. And I think as medical writers, I'd actually say we can set guardrails for that and support those type of developments really strongly as well.
That's really interesting. Can I ask you a question about how you were trained in AI? So what kind of things did you have to do when you were learning about it and using it?
So I will say I'm 100% self-taught for AI. It was a conscious decision to just look into it a little bit further. Initially, it stemmed from how can I use this for improving the quality of a microfluidic system of all things. But it really evolved as to what constitutes AI. Like, what would I use to build an AI system? For vision, it's things like, photos and videos that really are key informing features. For things like writing content and medical decision-making, data becomes very, very important. What are you sourcing? Why are you sourcing it? And what's the quality of your source as well? I think that's something that really drove me deeper into. It's great to understand the technical elements of AI, but data and understanding and clinical information are still high roles. For me, it was also a case of learning on the job with AI. Every job I've had has had an element of AI to it, and it's just like being thrown in the deep end. For me personally, I take the reverse engineering approach. I want to understand what are you going to do with this and what do you want it to impact and build backwards, because then I understand the full portfolio. It's not just AI system spits out this. It's who does it impact? How does it impact them? What kind of responsibilities and guardrails do we need in place for this? And that goes for writing, visuals, everything.
Love that. And so, what would you say are the biggest differences you experience between working in the UK and in the US?
That's a really good question. In the UK, I feel like we take a more thoughtful approach to integration of AI. We're very much focused on ethics, guardrails, and safety, which is extremely high value. I think in the US, things work at a faster pace because it's the home of evolution. Being based on the West Coast, there were AI models coming out multiple times a day that could do things better and better and better. But I also think that in the US, there's different levels of agreements. In the UK, there's a lot more transparency in information sharing and the way that we operate, but it's also ethically driven. We're not sharing personal details. In the US, companies are very protective of their technology and things around AI, which is why you end up in a lot of NDA situations where you have to be very careful what you can disclose, even after a contract is completed as well.
That's really interesting. And for the audience, if you're not familiar, an NDA is a non-disclosure agreement where you will agree to have access to certain information that may be required to do your job, and then you're not allowed to share that information with anyone outside of the people that you're working with. So that's quite common and interesting to hear that you've experienced that. And so you've also recently come back to the UK. So what was the kind of thought process and the decision making behind leaving the US and coming back to the UK?
Yep. So it's a very recent return, just a few months of getting used to it and getting used to driving on the other side of the road. For me, it was a conscious decision to come back, and I want to grow the tech space in the UK. I think there's so much potential for us to grow in the right areas and really become partners with the speed at which the US is moving. And I just really wanted to explore the UK's tech scene because it's emerging, it's growing. I've, had the privilege of working with a tech company that was spun out of a UK university system and helping them transition over to the US. And you can just see the potential for innovation in the UK in so many facets, deep tech with medical writing, clinical trials with medical writing, emerging drug technology with medical writing. Like there's so many touch point elements. And for me, it's exciting because you can really help these companies grow with different perspectives and bring what you know from both sides together.
Brilliant. I love that. Thank you for sharing that. I also wanted to ask, what would be your top tips for people who are, maybe they're a pharmacist or maybe they're a scientist and they're thinking of getting into medical writing? What would you say are the kind of steps that you took that worked for you?
I'll start by saying this. I think sometimes we don't recognize in ourselves as scientists, pharmacists, and clinical folks that we actually do medical writing on a daily basis. And we do it subconsciously because we're always translating complex information into accessible information. So number one, don't overlook the fact that you might already be a medical writer in your approach to things. Tips-wise, what I did for myself was a retrospective. What skills do I have and how could these integrate into facets of medical writing? Because medical writing is not just writing about a drug. It's so much wider than that. There's medical communications, there's patient advocacy websites, there's working with big pharma, there's working with companies who want to create content for things like supplements or wellness or holistic wellness. There's companies that want to translate how AI works in, the medical field so that doctors feel less intimidated, unsure, and black box about this. So I think really laying out the skill set that you have and creating these pockets of where you'd like to write and what you think you're a deep expert in as well, based on experience, is a really, really great way to start. I think from there, if you create scenarios, case studies, or just, really clear examples of things you've come across and format that into content is a really, really good way to start.
Brilliant. That was really, really insightful. So do you have anything else that you want to add as a final note?
Medical writing for me, I'll say this, is I just really enjoy it because it's great knowing things, but I really want to be able to share it with everyone. And how do I do that? How do I make it accessible? to me, it's also a great way of proving to myself, do I understand what I'm trying to convey here? I think we're more powerful than we realize. So it's my last note.
I love that. It's the people who understand that are able to teach that can, transfer that powerful knowledge as well. Mm-hmm. Even when I have to write about something that I don't completely understand, there's a big proportion of time that I spend just really trying to understand it so that I can explain it to a 5-year-old from the very basic elements.
Exactly.
Because if you don't understand it, you're not going to be able to write about it. And then
exactly.
Yeah. So thank you so much for your time. I will leave a link to your LinkedIn so people can check you out. And you're also going to be featured in Medical Writing Magazine. Yeah. So check out her article. I'll leave a link to the Medical Writing Magazine edition in the description below. So thank you so much for your time today and wishing you a wonderful day. Thank you so much for watching or listening.